Good evening. I am Teresa Bevel, a member of the Alaska Black Caucus, serving on the Health Committee, an organization that champions the lives of Black people in the areas of health, economics, justice, and education. Thank you for joining us for tonight's community conversation, Fighting COVID-19 Together with Facts. Please remember this conversation is being recorded for rebroadcast. So please keep yourselves on mute. If you have any questions, be sure to put them in the chat box and we will try our best to get to them. Please welcome tonight's moderator, Eric Gurley, who will introduce our panelists. Thank you.
Thank you, Teresa. Welcome, everyone. I'm Eric Gurley, a member of the Alaska Black Caucus Health Committee. Today's community conversation will cover two topics that are complex. Some of you may have heard of the terms trauma-informed care and mental health. The external challenge of COVID-19 impacts us all and has unveiled further challenges in our lives. We understand the topics today may be triggering. Please take care and be kind as we attempt to take this hour to provide plain spoken language to meet our goal to provide understanding, recognition, and resources for all our Alaskan communities. Next, it's my pleasure to introduce our two panelists for the evening. First, I want to welcome Tandra M. Rutledge. Everyone, Tandra is a mental health advocate, consultant, and suicide prevention educator. She is the Director of Healthcare Systems Initiative for Project 2025, a national initiative of the American Foundation for Suicide Prevention aimed at reducing the annual suicide rate in the United States by 20% by 2025. With over 25 years of clinical, healthcare, and executive leadership experience, Tandra is driven to dismantle stigma and cultivate resilience through a social justice and racial equity framework. A highly regarded speaker and trusted subject matter expert, Tandra fosters deep, honest connections with diverse audiences that heal, inspire, and transform. Next, I'd like to introduce Laurencia Reynolds, or Ronnie. Ronnie is a licensed professional counselor / supervisor and holds a chemical dependent certification 1. Ronnie is working in group practice, providing outpatient therapy and clinical contract work for a mental health / developmental disabilities organization. Ronnie's past experiences include 30+ years in the nonprofit sector, performing various roles in direct services and management within community health agencies. My faith and spirituality are very important and instrumental in allowing me to do the work to help others. I believe there's nothing like doing work you are passionate about. It makes it enjoyable and more than just a job. For context, we're talking a bit about COVID-19, trauma-informed care, and mental health, all as they impact people of color in the state of Alaska. Alaska as a whole at this point in time has had over 120,000 cases of positive COVID, and 574 Alaskans have died. We're going to reach out today and we're going to start with a short video on the subject of trauma-informed care.
You know the old saying, don't judge a book by its cover? Well, the same is true when you assess a patient. Hi, I'm Dr. Cruz. Early in my career, I noticed a pattern with some of my patients. They often had multiple health issues, were uneasy during office visits, and frequently visited the emergency department. But worst of all, they never got better despite multiple visits. Then I realized something. From an early age, many of my patients were exposed to trauma and adverse childhood experiences, or ACEs. This includes emotional, sexual, or physical abuse, violence, neglect, discrimination, poverty, and other adverse events. ACEs are more common in the US than you'd think. In fact, 60% of US adults have one ACE, 25% have 3 or more ACEs, and 16% have 4 or more. ACEs occur in all socioeconomic groups, but are more common in low-income and minority populations. For young children, repeated exposure to trauma can impact brain development and literally rewire the brain's response to stress. So as they grow up, many struggle with issues related to emotional regulation, like depression, anxiety, or substance use disorders. Trauma survivors are also more often at risk for chronic diseases, behavioral health problems, and even suicide. Knowing all this, I began to rethink my approach to care. Instead of asking patients, "What's wrong with you?" I ask, "What happened to you?" Recognizing that life experiences are often a root cause of poor health is integral to improving patient care. Trauma-informed care has helped me take these experiences into account, providing greater insight into my patients' needs and how to address them. Here are 5 key ways that healthcare organizations can gradually integrate trauma-informed care into their practices to help patients and staff. First, build awareness and generate buy-in. Involve both staff and patients in adopting a trauma-informed approach. Second, invest in a trauma-informed workforce. Hire staff that embrace trauma-informed care and provide training not only for clinical staff, but also for non-clinical employees like front desk workers or security guards, who are often the face of your organization. Next, create an environment that is safe and welcoming for patients and staff. Engage patients in meaningful ways. Ask how they feel and listen. You can also build trust by involving them in their own treatment planning. Finally, identify and treat trauma. Consider a screening approach that works for your patients and ensure that treatments and referral sources are available. These changes take time, but each step improves our ability to connect with and care for patients. Today, our patients appreciate the changes we've made. Plus, our staff is more in tune with patients, so work is less stressful and more rewarding. Trauma-informed care. It can truly transform the caregiving experience from being treaters to being healers.
Let's spend some time talking about trauma-informed care. You heard 5 different elements introduced in this video, but I wanted to go to our panelists and take some time to discuss trauma-informed care. Please relate it, if you can, to how you've seen the impact of COVID involved and sharing the experiences you may have. Let's start first with Kendra.
Thank you, Eric, and thank you all for joining us this evening. Well, there's a lot to unpack, right? From this video, as we were preparing for this conversation. You know, trauma-informed care changes your framework, from what's wrong with you to what's happened to you. One of the things in the animation that stood out to me that the video doesn't account for is the importance that we need to place on health disparities and inequities and structural racism in healthcare. So if you listen to the video, you hear the provider talk, saying that they're going to ask their patient, what's happened to you, and taking all of that information into account is so very important. But we have to also move beyond trauma-informed care to make sure that we're providing care that is based in anti-racism, because that is another component. It's important to understand how our healthcare system, the behavioral health system, the medical health system has impacted and created and contributed to trauma that many people experience, especially people of color, when they're seeking help. So that's one of the things that I wanted to highlight from the video, Eric. I know it didn't exactly get to your question, and I know we'll continue to talk about that, but I wanted to highlight that there is both a macro level that we need to look at these issues and a micro level. There are things that we need healing from, and that we're going to talk about coping skills, but there are also things that we need to hold our systems of care accountable for.
Thank you. Ronnie, what is trauma?
Well, thanks everyone for joining us. And thanks, Eric, for asking that question, because, you know, I was sitting here thinking, and as we have talked and preparing for tonight, I've done training on trauma in the past, and I know that there's lots of training and research in there, but, you know, during COVID, it made me look at trauma in a different light, especially after talking with some of my patients. It really got me to thinking for myself as we were looking at the video and talking before about the ACEs study. You know, there's a lot, as Tandra said, to unpack there. And the ACEs study, some may know it, some may not. But again, trauma is one of those things that is not a respect of person, and it comes in all shapes and sizes. And again, some of us may think of trauma as this, you know, big dramatic event. You know, we've heard about war veterans and PTSD and, you know, plane crashes and surviving train wrecks and things like that. But trauma finds us in all different areas of our life. And, you know, it's the small things, you know, as we talk about COVID, it was one thing for the disease itself or the infection and, you know, dealing with that. And then, you know, there was the fact of schools closing down, jobs being lost, families being, you know, disconnected, not being able to connect with loved ones. All of those things are traumatic in and of themselves. So for me, when we talk about this today, helping us to realize when we talk about trauma-informed care is that we can kind of look at it from all angles and not discriminate, if you will, against the big things that people see as trauma and the small things that we see. It was traumatic for me not to be able to sit across from my patients and have a therapy session. It was traumatic for me to not to have my daughter to go back to school. You go on spring break and a year and a half later, you're thinking, okay, what next? You know, so 1 degree, you know, for me may be a big thing, and for somebody else, it may be something else. So just being open to what trauma is as we continue to talk tonight.
Thank you. There's the term generational trauma. Tandra, can you speak to that?
Yeah, we've talked a lot about that as we were preparing for our conversation. And, you know, when we look at trauma, you know, defining trauma as, you know, Ronnie talked about, you know, when people think of big traumas, I don't want to use big traumas and little trauma, right? Because, you know, what's traumatic for me may not be traumatic for someone else. But what we know about trauma is that it can, there are different types of it, and it can be transmitted across generations. There's historical trauma, there's personal trauma, there's interpersonal trauma, there's racial trauma. So there are different types of trauma that we may experience. And it's not one or the other. And for many of us, it's cumulative. You know, it's cumulative. I think when we were preparing for this, I shared with you the example of maybe a year and a half ago or so, and I was sitting in the living room and I was watching the news, and I had a traumatic response to the news. I had a physical reaction to what I was watching with all of the images. This was shortly after the George Floyd murder, and we were in COVID. And I noticed that my heart started racing and my hands, you know, became clammy, and I got really anxious, and I noticed that was happening. That was a traumatic experience. It was triggering things from the past in me, right? And I recognized that. And so it's important for us to understand, you know, sometimes we're triggered by things that may have happened to us in the past individually, but sometimes we're triggered by things that happen to groups of people that we belong to. So as a group, as a culture, we share certain things that have happened and certain traumas and things that have happened in the past, you know, and those impact us. There's a such thing as vicarious trauma. It doesn't have to happen to me, it happened to someone else. I've endured vicarious trauma by hearing of the traumatic experiences that my family members, the elders in my family have experienced. I didn't directly experience them, but they are traumatic for me, and they come up for me in different places in my life. And I think about, where is that coming from? Oh, you know, my great-great-grandfather endured this, and this is a story that's been passed. This is an experience, and it's trauma. So when you experience trauma, it doesn't have to be something that you directly experience. And so I think that kind of might address your question, Eric, in terms of the generational trauma, things that are passed down and can be passed down to us as within our families, as well as within our cultures. And it's important for us to understand the importance of racial trauma. I saw someone put in the chat that the ACEs didn't account for racial violence, is not addressed. And very honestly, racial trauma is not even addressed in our healthcare system or in our mental health care system as well. And we know that racism and discrimination and experiences of oppression can be in our traumatic experiences that affect us mentally and also affect us because that stress lives in our bodies and it affects us physically. And so these are things that we have to begin to talk about and understand the connection between those traumas that we experience and our mental health and our physical health.
And Ronnie, one last question on trauma before we move a little to mental health. Can you talk a little bit about loss and loss that's occurred during COVID-19? You touched some on this, loss of identity, roles, family, friends, grief, loss. And we have a slide, if we can get that slide popped up for just a bit while Ronnie's answering.
Yeah, and I think, you know, the idea of loss, again, comes in various ways. And again, there is loss that we've experienced. And as we're talking about this, if you will, under the umbrella of COVID, and again, you know, it's apparent to see, as Eric mentioned, the numbers, the amount of deaths that we've had due to COVID. But there has been so many things that we have lost or that has been lost. You know, our sense of identity, you know, the roles that we were so accustomed to and familiar with within our jobs, even within our homes, within our families, you know, the role we played, those all changed when the pandemic hit. We had to learn to take on different roles and responsibilities. We had to learn to do things differently. So we had people who, you know, were losing loved ones, who were losing jobs, who were losing a sense of identity, who was losing their place in society, if you will. You know, even, you know, with sports, those who are in sports, our faith communities, all of those things. And that impacted our mental health in a lot of different ways. And we all experience grief and loss in different ways. And so when we just think of, you know, the pandemic, some might, you know, initially, or, you know, what might first come to hand is, you know, how many people we have lost, you know, who have died. Yes, that's major. But again, we also have to take into account all of the other losses. And for me, being in group practice and sitting across from people every day, when I look at them and when I talk to them, I have to see them in a different light. And I can't just say, oh, they're dealing with COVID. But I have to, you know, remember, as this, you know, the slide shows here, that grief looks different for everyone. And, you know, what people have lost, to really take that into consideration as I'm providing services for someone, as I'm trying to be of support or help, and even for myself, when I'm sharing with others or when I'm seeking services or support, how I express myself, not feeling like I have to, you know, put loss in a certain category or in a certain way. Again, going back to trauma-informed care, we have a responsibility to help to create the system that we want. And part of that is being open and honest and telling those who may not be aware what loss is for us, what grief looks like for us, helping them understand what my trauma is, and it may not be what they may see it as. And so again, all of this in my mind is a way for me to help to create the system that I think that we're talking about. That's what's missing.
Thank you. Transitioning for our dialogue to mental health. This past week has been National Mental Illness Awareness Week, October 3rd through the 9th of 2021. Today, October 10th, is World Mental Health Day. The theme is Mental Health is an Unequal World. I wanted us to explore mental health, helping understand the mental health condition, and then if you could contrast that against chronically mentally ill. And what I'm hoping to gain is an understanding of how people may have been different or become different due to COVID and the activities therein, as opposed to some people hearing through media and other sources examples of behaviors related to chronically mentally ill or other behaviors that may not provide the same picture, the equitable picture. So let's, from what I understand, mental health impacts us all. So let's have that discussion. Tandra, can you help us understand what is mental health?
Thank you, Eric. I love talking about mental health. We had a slide up there a moment ago with a brain, and it had what mental health is, what mental health is not. And mental health, it's important to understand that mental health has to do with how we think, how we feel, and what we do, right? It has to do with our emotions, our cognitions, our psychological makeup, our social well-being. It has to do with how we interact with one another, how we show up for school, how we show up for work, how we navigate relationships and solve problems. And so it's really important for us to understand that that's mental health, and that we all have mental health just like we have physical health. And mental health is equally as important as our physical health. And so one of the things that I love why I love talking about mental health is because I want us to get the facts right? Oftentimes when we're having discussions about mental health, it's always something negative. And that's not what mental health is, right? We all have mental health. It's on a continuum. We have good mental health days. We have not so good mental health days, right? Again, it has to do with how we think, how we feel, and how we behave. And there are lots of things that impact that on a daily basis for everyone. And throughout COVID, we all probably can attest to the fact that we haven't been okay. And that's okay that we haven't been okay, right? And creating a safe space for us to say to one another, to our friends, but also as helping professionals to be able to say when we're not okay. And so it's important for us to understand and separate fact from fiction. It's also important for us to highlight the role or the impact that stigma plays, right? Our negative perceptions about mental health, how stigma plays in terms of the role stigma plays in terms of people's willingness to talk about mental health. So if I'm willing to stand up and talk about my mental health, hopefully that encourages other people to want to talk about their mental health. So we have to create safe spaces so that we can have conversations about mental health. Now, I know, Eric, part of your question was that distinction, but I want to have Ronnie talk about that because I think she has a very good way of helping us understand that distinction between, mental health and well-being, right? What we're talking about, and when somebody might need some professional support or have a mental health condition or disorder. So I'm going to pass it over to Ronnie for that explanation.
Ronnie?
Thanks, Tandra. And I'll just jump right into that because, again, I like Tandra when you talk mental health. I like talking about it because I learned that what that meant to me, and that it was different than a mental illness. And based on my experience, and as Eric said in my bio, have worked in the field in some capacity for almost 35 years now. And most of that time has been spent working with folks who experience chronic mental illness and developmental disabilities. And so I want to make that distinction today because, as I'm trying to keep this in the context of COVID, if you will. For me, during COVID, it was made apparent to me just how relevant or how prevalent mental health is, and how we, especially African Americans, tend to avoid taking care of our mental health. And for me, I had the experience to see COVID really show that for us, because we experienced life really different during COVID. And so again, really having to embrace the idea of my mental health in comparison to my physical health. And again, the unfortunate part of that is for African Americans, we sometimes tend to neglect both of them, our physical health as well as our mental health. But for me, I think what I want to say today is that there is a difference, again, between your mental health and having a mental illness. And from my experience, the work I've done in the past with chronic mental illness consisted of someone who actually had a mental illness, meaning they had a mental health diagnosis. And typically that was a chronic disease of schizophrenia, bipolar, personality disorders. And again, I don't say that to discriminate or to put that in a bad light, because again, with the right help and treatment, that too can be managed just like our mental health can be. But our mental health is our day-to-day functioning. And it's when those things get in the way of us being able to function in our daily roles of parent, caregiver, spouse, employee, coworker, church member, whatever it is, when our mental well-being, when we neglect to take care of our emotional self, and then we can't function in our daily roles, then we need to really look at, okay, what do I need so that I can be mentally well? And COVID for me made me realize I tend to neglect that, and we need to focus on that. And so if we as mental health providers are more open and honest about our own mental health, and that we all need at some time some support, and that may look different for all of us. Sometimes that support is doing just what we're doing. And I think Tandra and I talked about, some of the things we do, which we'll talk about a little bit later, to take care of our mental health. But that's the first thing, is recognizing that we all have mental health, and that it's important that we make sure that mentally we are well, just like we should do physically, emotionally, spiritually. We're a whole person, so we need to make sure we address each of those different areas of our life.
Thank you.
I hope that hit it for you, Eric, and for our audience.
It starts to dialogue, right? I heard an example related to COVID. I don't know what mental health is, but since COVID-19, I know I'm different. I'm more emotional, right? So is that a mental health condition, or is that a recognition of mental health need?
Yeah, and I think that's just, again, good question there, because I think being able to recognize that I'm not well emotionally, just like we recognize, oh, my foot hurts, my head hurts, or, we are not feeling well physically, we figure out what we need to do to feel better physically. So in turn, when we recognize, wait, I'm not sure what's happening here, but something ain't right. That's my, y'all gotta accept that something ain't right today. I'm more emotional. That means I need to check it out. I need to figure out what's going on emotionally. That's my mental health. And so when Eric brought that to us, was like, yeah, that's it right there. Somebody recognized their mental health is out of balance right now.
And I hope what COVID has done by us having these conversations, and I know lots more people are having these conversations about mental health and COVID and trauma, which is great, right? That we're talking about these things, that more of us will recognize when we're not okay. Like we'll recognize when we are feeling emotional, or when we're frustrated, or when we're anxious, and we'll identify ways to take care of ourselves. Because Ronnie, I love your example when you were saying like, hey, when I get a headache, I recognize that I have a headache and I may take something for the headache, or when my foot hurts, I take care of that. Well, when you're not feeling okay, when you're emotional, when you're angry, or whatever it is, when your mental health is not okay, we want people to identify those times and then do something about it, do something positive to take care of your mental health. And with COVID, I've had to get creative, in terms of how I do that. And Ronnie said something really important earlier. She said, whatever it is, whatever you do for you, you do for you, right? And you can get inspiration from other people, but no one can really tell you what to do to take care of yourself and your mental health.
This leads a little bit back to the trauma. If you're doing that, it is becoming more and more well known about how different people are treated differently when they're seeking medical or therapeutic supports. So for example, Black women have a harder time of being heard. That's the language I'm going to use when going to their physicians. What experiences can you share with us that you may have even encountered as a provider seeking maybe your own support or resource? What guidance can you give others who may have been in that same position?
Really, Eric? Oh. Ronnie, I
can share my own example if that would help.
Yeah, it just, when you ask the question, I got a flood of examples, honestly. I honestly got a flood of examples, and I thought to myself, when don't I experience it? Mm-hmm. So feel free to go ahead and share why I work with the flood of thoughts that I have in my head.
Well, the first thing I would say is resources themselves are sparse when a person of color is looking for a therapeutic relationship. The ability to find persons of color can be slim. I think in our dialogue, we even heard examples of people needing to go out of the state of Alaska because one, Alaska is a state of 1 degree of separation. So a lot of people know one another. But the other, even Tandra, in your example, you shared that there's not a lot of African-American resources. And I don't know that many know, but you're outside the city of Chicago, which had my jaw on the table because I wouldn't have thought that was a problem, right?
Yeah. I remember when I shared that with you. So we know that our healthcare system, does have, a history of inadequate resources in general, but specifically for minoritized populations. And there are limited number of people who are people of color who are clinicians to support and treat individuals, and also lack of trained individuals in cultural competency and racism. So it's hard. And I think what I shared was an example of seeking support for my son and through my insurance, and could not find anyone for him to see in person, a male. And now let me be very specific. I was looking for a Black male therapist for my son, and there was no one. There was no one within a 50-mile radius. And so I had to go to teleservices and online services. And I remember sharing that with you, Eric, and you were like, what? You're in Chicago, what? So there is that, right? There is that challenge of finding someone that you feel comfortable with opening up and having that, creating that safe relationship with. And that's a challenge. That's a challenge for lots of people.
Yeah, and Eric, if I may just chime in on that, it's very relevant to me here in Alaska, both personally and professionally. And I think as we were preparing and talking amongst ourselves, I'd shared that I had a young lady, an African-American young lady, contact our office and asked specifically to see me. And, just in kind of making the initial phone call before I actually did an intake. And she shared with me that she had been in therapy and therapy was working for her. She told me about some goals that she had reached and talked about how well she had connected with her therapist. And I thought, okay, tell me a little bit more. What happened? Why are you seeking, a change? And it was during the time when all the protesting was going on, during the whole thing with the incident with George Floyd and, the trial and all of that. And she said, right now, I just need someone who looks like me and who can relate to what I'm going through. And when I talk about these things, that I feel like I can talk about it and you will understand. And she says, and right now, the person that I'm seeing, they're not a bad person, or there's nothing against them, but she just felt like she needed someone that she could relate to. And me being one, a female and an African-American, she was comfortable that. And, initially I would be a little hesitant, just trying to do continuity of care and being respectful of other clinicians. I want to, make contact, let's talk about this and let's pass, do a good pass off, for a patient. And I asked her, well, can I talk with your current therapist? And she says, I'm okay, I'm good, no need to do that. This is just what I need for right now. And so that was just an experience for me, because I had to really look at this big picture. I had to put, what I would normally do day to day just to take care of business. Again, I had to look at things from a different perspective. So that was just professionally. And then for me personally, being in the field and just living life in general, stuff happens, and there's times when I can say personally, I thought, man, things are getting pretty tough here. I need to talk to somebody. And I want to address this as well, because in the chat, someone made mention of, we think we got it all together. And especially as professionals, I want to present a certain way. I got to keep it all together. I'm supposed to be this. I should do this. I got to do that. But every now and then, I don't know about nobody else, but every now and then things get to be a bit much. And I feel like, okay, I need a minute. I need somebody else to talk to. I need somebody to talk to me. And I can tell you, for me personally, there's been times when I thought, I don't know, I'm gonna have to go out of state to talk to somebody, because one, I got to find somebody here who I feel like I can trust. And again, those are my own issues. And as Kendra was talking about earlier, generational stuff, some of that's generational. And some of it is just because in Alaska, big place, but as Eric said, when you talk about mental health and you talk about clinicians, we can get real small real quick. And so again, being the few that at least I'm aware of and knew at the time, I thought, no, I think I'm going to pass on that. I'm going to have to look outside. And that's very unfortunate, especially being in Alaska and you don't like to fly. You figure like you got to go out just to get some help. And so again, as we're talking about COVID, I think, and I may be jumping ahead, Eric, but I think for me, that's one of the things that I said has been advantageous with COVID is telehealth and being able to access mental health without having to physically go places. For some of us, that might be very helpful to be able to do. Others, it don't work. But for some people, that means I can get it, the mental health help that I need. That's a safety, net for some people as we talk about trauma. It may be traumatizing for me to go in person to sit across from somebody or to be physically present. But if I can do it over Zoom or what are the other options people use? I don't know. I use Zoom, so I've come real close with Zoom lately. But that can be, again, a big difference maker for folks who need some support with mental health, that I can do it there. So just as we're talking about limited resources, I can say I truly have been affected by that. And I'm grateful that our community here in Alaska is doing more to grow our own, if you will, and to increase the number of African-American mental health providers.
Thank you. Thank you. I want to pause and take a moment to see if there's been any questions from our Facebook Live.
Eric, I can share a couple of questions from the chat.
Please, thank you, Thea.
One from Cal a bit earlier. Are there disparities in the treatment and effect of COVID-19 experiences by our inmates of color in the correctional system? What can we do about this?
Good question. Panel?
I'll just speak to, again, what has been my experience or what I have been in conversation with those who work in the correctional facility here in Alaska, or having the experience of knowing someone who has been incarcerated during COVID. And again, so just know that I'm basing this on what secondhand information, if you will. And there is a difference that at least is being reported, and not, again, anything that I can say based on research. But again, I don't think that things necessarily change so much just because I'm in a different environment, different location. What I'm learning as we as African Americans, we have to, I think, be good advocates for ourselves in being open and willing to share our experience and talk about what is traumatizing for us and when we are discriminated against with regards to the treatment or the services that we receive. And I'm grateful for conversations like this, for just practical, down to earth, everyday kind of talk for people to know that you're not alone and that there's others who are experiencing this at different levels. And so hopefully that it will encourage us to, speak up and speak out.
And I would say we recognize in this 1 hour, we're not going to cover everything, right? This might be part 1, 2, 3, 4. We're going to leave it to the leadership of the Alaska Black Caucus. But that question, there's another question, and I see this one in the chat that's from Jewel Jones. What resources are available to students who are experiencing mental health issues? Tandra, can you speak to that?
So I'm going to speak in general, and I know we're sharing some resources specifically for Alaska. So in general, if for students, so if you or yourself are experiencing any symptoms or anything that you're concerned about as a student, I would first encourage you to seek out the counseling office at your institution for resources. That would be the first place that I would encourage you to go to the counseling office to get resources. There also, you can also reach out to your primary care physician and let your primary care physician, know that you're struggling, you're having difficulties. There may be people within, if you belong to a faith community, the important thing is to let somebody know that you're not okay. Don't be afraid to have the conversation and reach out to other people to let them know that you need help and you need support. There's a National Suicide Prevention Lifeline number that you can always call if you're feeling suicidal. There's crisis text. I know we're going to have those resources available, as well as resources very specific to individuals who live in Alaska. And on AFSP's website, afsp.org, there are a list of resources for individuals from diverse communities, including what Ronnie talked about, many resources that people are offering that are teleservices and support and information. And so I would encourage you to reach out for help if you are struggling. There are some very good online screening tools, that you can take an online screening, just to kind of see how you're doing. So there are lots of resources available to all of us if we're struggling. So I would encourage you to make sure that you reach out. Don't be afraid to reach out.
Thank you for that. Don Roberts asks, how can people address gaslighting when they experience it? Who would like to take that question? Thank you for that, Don. We talked a little bit about, the mean actions, as we were calling it, the bullying, misinformation, and how to move people past that to be healthy and not disparage their own opportunity to be healthy. What are some of the strategies that you as therapists and clinicians have used to help your consumers and clientele when they brought this topic to you?
Again, for the purpose of what we're doing here tonight, Eric, I don't want to get us off track, but gaslighting is very real, and it comes from, a place of someone themselves who is the perpetrator, if you will, or someone who is gaslighting someone else. I think that comes from a place of someone who may be experiencing some mental illness themselves. And so again, keeping things into context for the person who might be feel like they are experiencing that, again, being able to seek some guidance and assistance, some support, because it's very real. And, you're dealing with someone who has some narcissistic tendencies, some controlling type behavior. And so again, one, to make sure that you're getting the help that you need. So definitely can talk maybe offline, or if that's something someone is really dealing with and needs some help and some guidance, Eric. So again, just trying to not, downplay that any or shorten it, but again, that it's very real and it's happening more and more as we talk about, COVID during the pandemic. Everybody needs to be aware that it's bringing out some not so good things in some of us, as well as some good things. And so as we talked about, the schemes, people being mean, or just from out of ignorance or lack of understanding, or people dealing with their own mental health, mental illness, those kind of issues, that things are happening and some of us are falling victim to that. And so again, seeking the help that we need.
Just to add on to, what Ronnie shared, which I think is really great feedback. One of the things, just to reiterate, is that it is real. Gaslighting is real, and it's traumatic. It really, if you've ever experienced it, right, you know the impact that it has. And so in terms of addressing it with the individual, you know, often does not work, right? And so one of the things that we can do when we experience that is to make sure that we have a support system, that we have individuals that we can process that with, and so that we're not left with those bad feelings, right? That we create an opportunity and a community where we have some safety and we have some support when we experience these types of traumatic events. Because as Ronnie said, gaslighting is real and it affects us. It affects our mental health well-being, and it can be very traumatic when we experience it. And so it's important to take care of yourself and to call it what it is, to say it, to name it what it is, and to know that it impacts you.
Thank you. Have another question. First, let's just to be clear, can you define gaslighting for all of the group and those out there?
Yeah, I guess one of the a simple explanation of gaslighting is when someone tries to manipulate you psychologically by questioning your what you're saying or your sanity, right? Making you think that what you're saying is not real, right? Someone who is, you know, saying things that are untrue, right? That really they keep saying it, and then they make you question whether you are perceiving things right, you know, so they try to manipulate you psychologically, where you're now questioning your own sanity. And it is very harmful and very toxic to people's mental health. And there is a lot of that going on. There is a lot of that going on in the larger society, especially. Is very pervasive, yes.
On the streets, they might call it geeking somebody up, right? Getting them all going. So and it can lead to violence. So there's a lot that can end poorly with that. So I appreciate you guys taking the time to talk about not just coping strategies, but even some tools like having your people that you can go to, right?
Yeah, and can I just say this, Erica's Tandra nicely said in defining that. And you know, when we experience trauma, sometimes it causes us to not think in a way that we would normally think. So as we talk about this whole gaslighting thing, you know, it's very real for some of us to question, okay, am I just, you know, over exaggerating? You know, am I just making this a big deal? You know, is COVID all of that? You know, well, you know, things are okay. Well, everybody is going through this, or, you know, I just, you know, somebody said this to me, it's probably not a big deal, or wait a minute, is that really a big deal? So again, just know that when we are experiencing something as a pandemic, that in itself makes us kind of question, like, okay, wait a minute, what's really going on here? Am I okay? Is this okay? And then you have someone come along who take that to the extreme, or who tried to manipulate the situation. And right now with COVID, a lot of people are taking advantage of the situation, if you will, the pandemic, and using it for things that are not good, not healthy, or not helpful. And that's because they're experiencing their own issues. But again, I think it's just a good reminder to pay attention to yourselves. And again, if you're concerned, like Tandra said, talk to somebody.
Mm-hmm. Let's take one more question. What would you say, or would you say there's a difference between mental, emotional, and spiritual health? And we have 3 minutes left.
Easy answer. Yes, I think there is a difference. No, I think there is a difference. And you know, I think it is. And as I mentioned, I think I use the term, we're a whole person. And that whole makes up a lot of different pieces. And I see that my spiritual health is one piece, my physical health is one piece, my mental health is another piece. And sometimes when one of those is off, it impacts the other. And so when I'm not, spiritually healthy, I feel a little emotionally kind of drained or down. When my physical health is not okay, sometimes then I neglect my mental health. And so I think being able to recognize what's different and being able to address them all, and sometimes they do overlap, or one thing does impact all of them. But again, that looks different for everybody, because what I consider is, for me, my spiritual health is my faith and my belief. My mental health is more about my emotion and how my feelings. And I try to separate necessarily what I'm feeling from always my spiritual, because sometimes I don't feel what I know I believe. And so I can make that distinction. And then of course, my physical health, I think about, okay, why am I having these headaches for, 3 weeks in a row? Something's going on. I need to go get that checked out. Oh, that's stress, my mental health. So now my mental health is impacting my physical health. So I see them as different, and all of them are just as important. If I'm diagnosed with cancer over here, I'm gonna go get taken care of. If I'm stressed out and overwhelmed by whatever, that's my mental health. I'm gonna go get that taken care of.
Tandra, do you have any comments?
Oh, I 100% agree with Ronnie. I mean, we are very complex. There are many dimensions of our well-being, inclusive of our mental, our emotional, our physical, our cognitive, our financial, our relationship. Like, there's so many aspects to our health and well-being, and they're different and they're related and they impact one another. So I 100% agree with Ronnie in her explanation, and it was a great real life example that I hope that everybody got clarity on. Very well stated.
I cannot believe the hour is already up, and I feel like you guys are just getting warmed up, right? If we can we post a quick visual of the resources? What we like to do is make sure these are posted on the Alaska Black Caucus website for folks to go and see and use, and please share. As always, we have more to discuss on this topic. Stay tuned. Like I said, we knew this might be a part 1. And everyone, we will look at any unanswered questions from tonight and do our best to create further moments to address them. Please thank our panelists and our wonderful folks for helping out with the visuals, and those who work in research has brought us this conversation and made it work. Please be kind, and remember, we all may be working on ourselves. Be kind to those around you. Teresa will now provide our closing comments. Teresa?
Wow, Eric, thank you so much. What a fantastic conversation. Again, thank you all to our program participants, and of course, you, the virtual audience, for joining us this evening. We also want to thank our Black Caucus members and Allies for Change group for their continuous support. If you would like to join our great organization or link to the Allies for Change group within the Alaska Black Caucus, please visit us at the alaskablackcaucus.com. We would also like to thank the Municipality of Anchorage. This program was supported by a grant awarded by the Municipality of Anchorage, Anchorage Health Department. The opinions, findings, and conclusions or recommendations expressed in this publication, program, and exhibition are those of the authors and do not necessarily reflect the views of the Municipality of Anchorage, Anchorage Health Department. Please be sure to join us next Sunday, October 17th, as our topic will be remembering Betty Davis. You are all invited. Again, thank you so much. Until next time, good night, everyone. Thank you.